Hello, everyone. Good afternoon. It is my pleasure to be here with you this afternoon to discuss the importance of airway clearance and different types of airway clearance. I am very fortunate this afternoon to have with me Jennifer Rifrigieri from Moynihan Healthcare and Megan Marshall from Baxter Corporation. Why we're having this airway clearance workshop? It is very important as cold and flu season and pneumonia season begins. And the best evidence shows that daily airway clearance helps the pulmonary system, and it also keeps our children healthy. At Boston Children's Hospital, we take great pride, and we are vested in taking care of your children. When your children walk through our doors, they become our children. And with that said, I would like to show you some different types of airway clearance. We will have some hands-on and show you how the devices work. Some are, electric, some are portable. There are many different types, and that's what we'll be exploring in the next half hour. And with that said, Jennifer.
Great. So thank you, Eleni. Why do we use airway clearance devices? Well, with heterotaxy, there's a plethora of different surgeries out there, and there's concern of post-op pulmonary complications, on top of perhaps just having issue to begin with bringing up secretions. This is a way to help keep those lungs healthy and mimic that of the cilia within the lung, so that they are able to bring up those secretions that make you feel, how shall I say, verklempt. So it is a technique that helps people clear their mucus from their lungs. There's various methods out there, like Eleni said, but today we're going to be focusing on just a few to give you guys a breath of what we have. So more importantly, today we will be discussing what is called the Aerobica device, and there's one here. And with this device, again, it is helping to replicate that of the cilia to bring secretions up. As you can see, this is very portable, discreet. It is something that you can either keep in your backpack, keep at home. For patients that are looking just to have a regiment of airway clearance, twice a day is all that is needed. So this being kept in the medicine cabinet at home is sufficient so that when they go to brush their teeth in the morning, brush your teeth in the evening, this is a proper way to help keep that regiment going and keep those lungs clear. Now, other scenarios where they might start to build up secretions, we recommend using it up to 4 times a day. And so it's a way to be able to have a device that helps to bring those secretions up. There are actually 5 different resistance settings within the device. I'll go through the mechanics in just a minute. But this basically gives more back pressure as the patient is exhaling through the device, and in turn helps to stent open the airways. And then there's a vibratory component that helps to shake up the lungs and provide those secretions coming up. Similar to that of chest PT. I like to joke that this is kind of like chest physical therapy in a bottle or in a little pocket device. One of the other things is that this is good for an entire year. So something that is very important to keep in mind is that because you're breathing in and out of these devices, we want to make sure that we're cleaning them as well. And we'll go over the cleaning instructions in just a bit. There's no side effects. This is a drug-free way to get those secretions up and out. It's kind of like jazzercise or aerobics for the lungs. It's a way to just help exercise those lungs, get the secretions up and out, and as said, it's good for 12 months. Now, for those of you who are engineers and really want to understand the dynamics of certain things, with the device, when you inhale in, if you see the one on the furthest to the left, that is as the patient breathes in. There's a little green flap here that moves forward. And then when the patient goes to start the exhalation process, that flap moves back up, and then the exhalation carries down through here. And right at this point is where the patient receives their resistance. Okay, so it's just a little area of, or surface area that the patient is exhaling through to receive their resistance. And again, you are able to make that resistance more or less, so the opening becomes bigger or smaller as you are adjusting that resistance. And then it carries up and through to this vein that shakes back and forth, that again, kind of provides that vibration, having those secretions start to come up through the airways. As far as proper technique, we are going to watch a really quick video on doing this. But in general, you always want the patient to be sitting upright. You want to make sure that they have a long, exaggerated exhalation as they're exhaling through the device, and have it 3 to 4 times longer than that of the inhalation. And we'll see that in the video in just a sec. And one of the things that I get a lot of questions about is, how do we know the resistance settings? And again, a lot of times what I'm working with is in the hospitals and dealing with the respiratory therapists and the nursing out there to help explain how we have our resistance settings. But the goal for our patients, the goal for the children out there, are that we want them to have, be able to achieve 10 consecutive breaths through this device. That is ideal scenario. If they can't, we're going to reduce the resistance setting down to be able to open up that surface area bigger and make it easier for them to exhale through. And so those are one of the key things, is really making sure that they do this not for more than, our product insert says not for more than 15 minutes. God love you if you keep going beyond that. But to not, just to be able to do 10 breaths, pause, have what's called a huff cough. We'll go over that in just a sec. Bring up those secretions and then repeat. Okay, so I'm going to play this little video. Oh, no. Apologize. I wanted to make sure it was playing beforehand. Okay, conference. Oh boy. Oh, now it's. V as in Victor. Oh, B as in Boston. OS. Yep. DM. Write out Marriott. 2. Okay. Thank you. Apologize for that.
Please follow these simple instructions when using the Aerobica OPEP device. Check that your resistance indicator is set as prescribed by your healthcare professional. Put the mouthpiece in your mouth, closing your lips around it, forming a good seal. Make sure your hand does not block the open circle at the far side of the device, opposite the mouthpiece. With your lips still sealed around the mouthpiece, inhale deeply. Hold your breath for 2 to 3 seconds before exhaling actively, but not forcefully through the device. Active exhalation should last 3 to 4 times longer than inhalation. Keep your cheeks flat and firm. For example, you should exhale with a firm, steady breath, similar to blowing up a balloon, rather than using a fast, forced breath, which is similar to blowing out candles. Continue taking deep breaths and long exhalations for 10 to 20 breaths, or as instructed by your healthcare professional. after which you will perform 2 to 3 huff coughs to clear your airways. To huff cough, sit up straight with chin tilted slightly and mouth open. Take a slow, deep breath to fill lungs about 3/4 full. Hold breath for 2 to 3 seconds. Exhale forcefully but slowly in a continuous exhalation to move mucus from the smaller to the larger airways where it can be coughed out. Continue with the Aerobica device and huff cough cycle for 10 to 20 minutes, or again as prescribed by your healthcare professional. Treatment should be performed twice each day and increased to 3 to 4 times per day if you are producing a lot of mucus. Stop using the Aerobica device and contact your healthcare provider if you feel dizzy or lightheaded, or if you have any discomfort.
Okay. Great. So we're going to quickly go over how to properly do this. I have Vanna White, aka Eleni, down here to kind of help and demonstrate. Let me detangle myself. So again, with this device, it comes either with just the mouthpiece, or you can have one with a manometer that allows you to have a visual of how you're doing upon the exhalation with the device. It'll always come in the number 3 setting as resistance. So again, you're gonna go up or down depending on if you're able to accomplish those 10 breaths, and also, are you able to bring up much secretions? So, per the video that we just watched, I'm gonna ask Eleni here to be a very nice patient, maybe, and be able to do this device. Again, Eleni, when we put this in our mouth, we wanna be able to take a nice breath in, do a little small pause. No, not in through your nose. That's a great question, because actually what we would need to do is maybe plug or provide nose clips, because the effort and the benefit that you're going to be receiving is upon the inhalation through the mouth, not breathing through the nose.
So the other thing I see a lot of in the pediatric population is, unfortunately due to devices, I see a lot of rounded shoulders, which shortens the pectoralis minor muscle. And so a big thing that I encourage with these children is to open up the rib cage where you can take a deeper breath. That's great posture. Feet on floor. Sit back in the chair. It's very important. And this is what you do. So I take a deep breath in. 1, 2, 3.
Long exaggerated breath out. And you want to, in this case, we can see with the manometer, the device is starting to show the exhalation. And rather than having that exhalation manometer be going up and down, kind of like a wave, we want to see it stay consistent. So as you're exhaling, 1, 2, 3, perhaps 4, then stop.
So then from what this mimics basically is how the cilia beats in the lung. It beats between 14 and 16 hertz. And when you're getting that fluttering, that's what it is trying to mimic, and it will help with the mucociliary transport. It's like a mucociliary elevator, and brings the secretions up so the patients can expectorate them out. That's what the idea behind this device is.
And so yes, after she does, say, those 10 breaths, okay, 10 proper breaths, and produces that desired exhalation, we would then ask her to stop and do what we call a huff cough, okay? And when we do this huff cough, we always want to have a tissue in hand, not a cloth napkin, but a tissue in hand.
Or a little mirror for the little ones, because the little girls love fogging the mirror. That's
Yes.
another thing you can teach them.
And being able to, after those 10, go and hopefully have some secretions to bring up. You have the tissue, perhaps a cup, to be able to catch those, and take a quick break, and then start again.
I start another cycle. What I recommend is this done either with if your child's on nebulized therapies, albuterol, and any type of nebulized hypertonic saline, is actually, the Aerobica is a wonderful device because, and why we like it as clinicians, you can put your nebulizer on the back of it. So as your child is taking the breaths, they're also doing their nebulized therapies. It's a wonderful device. The other thing, why do we at Boston Children's, we tend to, advocate towards the Aerobica? The material it's made out of can go in a baby bottle sterilizer. You have to be careful with dishwashers because of the dishwasher filter sometimes has bacteria that some people don't open up their filters enough. So I really kind of stay away from the dishwasher. But you can wipe it down with rubbing alcohol, and you can, after each use, you rinse it with some soapy water, and we recommend Dawn, dishwashing and air dry it, and it comes apart very, very easily.
Yes. And so that brings us.
Yeah, they both work. Here we go. You get it?
Nope, I don't.
Oh. There we go. Pass back.
So that brings us to the next portion, which is going over the cleaning instructions that she was just alluding to. So again, this device comes apart really into 4 different pieces. You just pinch the middle here. You are able to have the bottom cartridge, the middle here, where I showed you, you get your resistance and also the oscillation here. And then the top portion plus the mouthpiece. If it has the manometer, you don't want to wash the manometer. That remains outside of the dishwasher and outside of the sterilizing process. But with these devices, as said, warm soapy solution, rinse clean, let air dry. That's always a beautiful method. Dishwasher, as Eleni said, you may or may not, depending on if this is something that you might not be regularly cleaning those filters, perhaps like myself, or you have 5 methods of disinfecting, and these are all within the CF recommendations as well. So just keep that in mind. And one other thing is, compared to the other type of pocket OPEP devices on the market, this is good for an entire year. And one of the things that allowed us to get that FDA approval for having the year time frame is that once a month, we do recommend having a 1 part warm water, 1 part vinegar soak, because depending on where you have your water, what type of, if it's soft water, hard water, there is mineral buildup that does start to occur with these devices, so we do recommend having that ability to have the soak as well. So we talked about some of those breathing techniques, and also recommend kind of that belly breathing, because again, nobody feels good when you can't quite breathe or take that big breath in or be able to exhale out if you feel like something's always stuck there. I am going to be turning it over now and to Eleni, and then she'll introduce Baxter.
Thank you, Jennifer. That was very informative. Great presentation. And now I'd like to extend a warm welcome to Megan Marshall from Baxter Healthcare. And we're going to be looking at another device that we use a lot and we prescribe a lot in our pulmonary clinic, and it is the pulmonary percussive vest, which is also known as high-frequency chest wall oscillation. So it's a little different. It does involve a device, but we're here to show it to you.
We do have a wonderful volunteer. Ethan's going to come up.
Again, just like the Aerobica, the chest, we call it the vest. The vest works by, it basically inflates, and the inflation, it's air, and the air puts some pressure on the chest wall, and it shakes. So again, we're mimicking the cilia beating in the lung, and the mucociliary elevator that brings secretions up from the lungs where you can expectorate them out. And this treatment is done, again, after nebulized therapies or inhalers. You usually wait about like 10, 15 minutes and to give an optimal treatment. And when we first prescribe them, we prescribe 20-minute therapies, and then as the children get older, we go to 30 minutes, and we use some different frequencies, which Megan will show us in a minute. Thank you. Volunteer. And again, Ethan has very nice posture, and he's got his feet on the floor and his shoulders back. You're a great patient.
So typically, these are our newer garments, so typically we actually want it right under the chest. It is a little bit big for Ethan, but we're making the best out of it. And we do start in different frequencies and pressures. However, right now we're on lower settings, so we don't make him sick after he just ate his lunch. The way it does work, though, so the high frequency chest wall oscillation, we're really looking to get the secretions from the lower airways up to the larger airways, and then we can expectorate them out, like similar to the aerobica, just in oscillating form.
And then the other thing you have to keep in mind, it's okay. And the other thing you have to keep in mind, that younger children are not going to expectorate. Young children usually swallow their secretions, and that's okay, as long as they're, they're still coming out, but they're going in their stomach. And sometimes when there's too many secretions, they may get a little, they may cough up, or the secretions will, like a whole bolus of, like, you think they're throwing up, but it's just secretions. That happens. And as children get older, and with the huff cough technique, you can expectorate those secretions. And that's what's going to keep the kids healthy. All right, ready, Ethan? All right. So this is the APX system. This is brand new. This was just released within 2025. And we've gotten great results with it. Can you say hi for me? Hello.
Does he get nauseous?
Do you ever get sick? No? Okay. He's great. Good.
It's just to show the difference from what 10 to 16 hertz.
Right. So this is going to shake more. So the idea is you start off at a lower frequency to get the smaller airways. Then you go to a medium, and then you go to a high frequency so you can get the secretions out. Are you having fun? Sure. Yeah, want to say it?
That's only for everyone.
Oh, okay. Well, Ethan, you've been a great sport. Thank you, Ethan. Yes. So, oh, yes. Yeah, so we did the other device. And the other thing is good old-fashioned, chest PT, percussion, vibration. We actually start when the kids are babies. We will do formal teaches. We'll teach the parents, whether in the hospital or in an outpatient setting. We will teach the manual techniques of chest PT. And then when they're about, I'd say, now this is our facility, our clinic. When the patients are about, when the children are about, I'd say school age, that's when we introduce a vest and or the aerobica, the PEP device. And then the PEP device, one great thing, Jennifer, is that you can travel with it. The Apex, this new Baxter device is, you can go through TSA with it. Usually your pulmonologist will give you a letter to fly with it, and it fits in, you can take it in as a carry-on, but you can also put it in the hull of the plane as well. But the aerobica, I give a lot to my athletes who will go, athletes or anyone basically who will go fly, and it's easy because you can put it right in your bag. But I stress the disinfection. because you don't know what the children can have. And the last thing I want to talk about before we wrap for today is the importance of exercise. Every child has something that they love to do. And to keep the children active, that's a form of airway clearance too. We at Boston Children's, we are great proponents and we encourage exercise. I think it's a wonderful thing, and playing with peers is a part of growing up and a part of natural development. So with that said, does anyone have any questions like that they'd like to ask? Yeah, yes.
So one thing, a lot of times our kids are recovering from surgery, abdominal surgery, chest surgery. So what are some things that they can do while they aren't able to do maybe the chest percussion vest or whatnot in order to help keep those lungs open and healthy?
Incentive spirometry. In my time in the ICU before, I've worked both services, inpatient and outpatient, and I worked in the ICU. The big thing is, one of the greatest thing is that evidence show, Nessia, that when children are mobilized earlier, when you get them up and out of bed, you decrease a hospital stay by 3 days. That's what research is showing us. And then I teach a lot of diaphragmatic breathing, and I do a lot through play. A lot through play. Like I'll say, okay, let's get you up, let's get you moving, and we'll do something fun like a scavenger hunt. And and then the other good thing is you can do a lot of splinting of the incision and taking breaths. But and the minute you start with the mobilization, early mobilization is a program that was started in Hopkins, BCH, all of the bigger pediatric facilities, and it's now an initiative across the United States. So that's one of the big things to do. Yeah. And the other thing we used to do a lot was blowing bubbles too, is a big thing. Yeah. Thank you, good question. Anyone else? All right, well, with that said, thank you very much. It was our pleasure, and we look forward. Anyone would like to have any questions, feel free to email us. Our contact, we can provide you with our contact information, and we're always available and happy. And it's with great pride we take care of your children. Thank you.